When a resident is struggling with respect to their communication skills, it's often helpful to step back and know that often if there's a difficulty in one area, there may be difficulties in other areas. So it's always a good idea to touch base with the program director just to make sure that they're aware and to get some guidance on how to proceed. And it's often important to know that there may be resident reasons why they're having difficulty communicating. It may be a particular circumstance, patient interaction that was very specific, and also the faculty that was with them may have had some challenges with the interaction as well. So it's always good to step back and go and say, you know, what happened with this interaction, or is there a pattern of activity here? Often the most helpful thing for the trainee is to work with somebody that they've got a strong working relationship with, and also to begin with data in a way that when we assess patients to try and identify their problems, we gather data by questioning and by examining them. And it would be the same with a trainee. So you interview them, you find out where they feel they're struggling, where they feel they could benefit from further improvement, and then you watch them, and you watch them a lot under different circumstances. You gather your data, and you observe them using a structured communication skills framework to make sure that you understand where the problem exists, and then to create your remediation plan from that. If this is an area that has to do with how they structure an interview, they're forgetting their time, they're letting the patient take control, well then that's an area that you can focus in on. If it's a problem with how they explain information, for instance, then you can step back and go, okay, let's talk about some of the strategies around communication skills training, and how you actually provide information in a way that patients can remember and understand and so on. So you can use that same framework to help a resident who is struggling. And it's also important to talk about, you know, it may be an element of expertise, so what they know. So this may be strongly linked to medical expert, but there may be a strong professional interaction here as well. Is there a perceptual skill that needs to be looked at? Is there a degree of respect, honesty issues, trustworthiness? Those things as well have a strong layer with respect to communication skills. So it's trying to unpack the content skills, the process skills, and the perceptual skills that all interact when trainees are struggling with communication.